first, any comments from the three of you about the three presentations? I mean, it feels like you're all doing sort of not the same thing, but you're sort of in the same kind of field. Who should I sort of trust? Who should I listen to? Who should I use?
You're doing great things. You're doing great things. Awesome.
You're the man.
Perfect. No, thank you very much, all three. Yeah. So I've seen you talking to each other in there, going, oh, this and that and this. What's going on? What questions, comments?
Yeah, I think we're going to start with Hiba, because we're going to start with a personal story. She has the most experience with the electronic health records, and I think that's a really good place to start.
Yeah, I was very interesting to hear about digital hospital, not just digital record, and also very interesting about digital management of diseases for diabetes also, and how much you think about to make it family friendly, because this is very important thing for me, I think, because I was discuss that with here about okay, we think about hospital, we think about professional health professional perspective, but should we think more about family perspective or patient perspective? Because, for example, as I understand now, or Karolinska Hospital ask to do that application for diabetes children. But for example, for me, I'm a mother for a Down syndrome child, and I'm controlling his health like more than 300 days per year, and maybe 1 day per year he visits his doctor. And I face a lot of difficulties during this year to control his weight, to monitor his health, to keep him as much as possible healthy according to his conditions. But yeah, is there a possibility in the future to ask, even now I'm using many tools, quantify self tools to monitor his health, but even those tools are not connected to his record. So what's the future ability to connect these tools to his record, because it's not enough to control his record because he just visits doctor like once per year.
Sure.
But for me, I am the responsible all the year for him. So, yeah.
So I think the concept of involving patients and their carers and relatives much more in the care of the patients themselves, I think, is absolutely one of the things that's going to save our health systems. Because at the moment, certainly in the UK, there's sort of an expectation almost of an abdication of responsibility. It's something we expect healthcare workers to do for us. And healthcare workers, there's no really good communication methodology, as you say, between what's happening on a day-to-day basis and actually the care that's provided in the hospital or in primary care. So we're rolling out later this year a patient portal. At the moment, the first stages of that will be all about making sure that patients can see the hospital record, but also be able to do things that you'd expect in a modern age about being able to rebook appointments if they're no longer convenient. But I can see as we go forward that will become much more interactive. So as I explained, it's really important that people with chronic conditions get the right care at the right time. And at the moment, we're focusing on making sure that the doctors know what that is. But I can see going forward, we want to make sure that patients and relatives could see that. I also think it's really important, as you've described, to be able to allow patients to input into the medical record via that patient portal, so that when you go to see a doctor, absolutely all of that information is there. Because actually what you do when you go and see a doctor, you spend the first 20 minutes explaining all of the things that have happened, and the doctor spends the first 20 minutes either writing them down or typing them in. There's got to be a more efficient way of doing that makes much better use of the doctor's time. So absolutely, I totally agree with you. I think that two-way interaction, so that becomes much more important. I think it's also more important certainly from a UK point of view, from a societal point of view, we're seeing increasingly that, whereas in the past, families lived in quite close geographical proximity. So elderly people would live with their extended family fairly close, possibly in the same house, possibly in the same street, almost certainly in the same town. Increasingly what we've seen is that that doesn't happen anymore. So elderly mum will live in one part of the country, the children and grandchildren will live many hundreds of miles away where the jobs are. And increasingly we're seeing that, wouldn't it be great if with the right permissions, if daughter or son who happens to live 50 miles away could know that their elderly mother had or hadn't taken their medications, had or hadn't had those examinations, had or hadn't actually performed those key health tasks that keeps them healthy and out of hospital. Because that's how it used to work, but it used to happen face to face. So I think you're absolutely right. There's much further to go on engagement of patients in these systems and bringing it all together for people.
I know, Anders, you had a comment as well?
Yeah, I want to touch on 2 points that you mentioned. One is the family friendliness. It is sort of a trick, of course, but it's based on the truth, we guess, that unless you like something, you won't use it. And the thing here is that this entire idea is built on the fact that data is flowing in. And the ones that are going to send the data are the patients or families in this case. And if they get fed up with this, or if it doesn't give them back anything or a lot every minute of the day, they will not sustain in doing this. And then the whole idea will fall apart. So that's basically our gift or necessary gift to them, to give them a platform that is extremely useful for them in every minute of their life, so that they can continue to feed the data. And that brings us over to the next aspect that I'd like to touch on, and that is that you're seeing healthcare 1, 2, 3, 4 times a year, right, with your son. And the regular chronic patient in maybe primary care would maybe have 1 visit or 1.5 visit per year. That's 2 data points, so 4 data points to cast a judgment on diagnosis and therapy on extremely little data. And it's unbelievable how they actually can do that with some certainty. With this other data flow I'm talking about, we can systemize this and actually create decision support tools for real that provides not only monitoring and alert systems and stuff like that to wake up the system on time, but it can also be the substance for smarter and more accurate diagnosis and therapy decisions. So these 2 things are tied together. And by doing this, then we can change the workflow and the care process, and we can save a lot of money.
Yeah. There's one more question coming up there, right?
Yes, there is.
I just want to break in with one, because I heard you also say that, I use all these tools to quantify, but how does it all connect? And I felt there was a missing link there that you described that you didn't have, that you were missing today. You do the measurements, but it's not connected. And when do I get my link? So when does she get her link?
We do it.
You do it?
Yeah.
Okay.
Like I showed in the slides, with the wireless blood pressure monitors that's working with Apple HealthKit. Well, everything that works with iPhones and Apple HealthKit, we support. And we can get that data to the doctor wirelessly. And yeah, just on a personal note, I feel a lot of empathy on like how much it takes the daily life. We started our company on the Diet Coke world of healthcare, like just on the outpatient primary care, but it's more and more moving to chronic disease management and monitoring, like creating that care coordination process of people with chronic conditions.
So we're definitely doing something about this. We're working on it.
Yeah.
Yeah. Now, sir.
Thank you very much. I think it was very good presentations going from digitized and connected, which are, of course, the start of everything. And then I think you kind of missed the interoperability part, but MeDoc got into that area. Just want to point out there are another like 3 or 4 platforms that you need to be interoperable with to be able to serve the patients. And then at the end, I think we got to the part which is so important after we've had digital transformation, or when we have digital transformation, which is automation. And this is where Diabetes Tools touches up on the subject, but could you elaborate a little bit more on that, and not only Diabetes Tools, but the other two, what you're trying to achieve in that area? Because when you get flooded by 300 days or more of data here, you'll need to get some smarter tools so that there is a good dialogue with the healthcare system when you actually meet 1, 2, 4 times a year.
Yeah, we consider ourselves just in the beginning. We have now created the technical platform to base new functionalities on. The decision support tools is one of those, based on big data analytics support in comparison to the individual, so that you, by more or less automation, can provide healthcare staff on all levels with very pronounced support in terms of decisions that they can solidly rely on, because it's based on big population data compared to the individual that you have in front of you. So we are not even there, but we have the dream for sure. What we do now is trending, alerts, monitoring of ramps that goes the wrong way and stuff like this. That's just the start. And that means that the system will give you a signal to look at something. We do not consider that decision support. This is just a wake-up call. But this will move on as we go. And as we start to connect and collaborate with big data people with smart brains, this can develop until the end of times, I guess. Healthcare will still need to be there. There is no risk that doctors will be out of job, but this is the way to solve the staffing situation that we face in Europe all over, because you can use your staff in a completely different and more effective way when they are proactive, supported by technology, rather than just doing the same routine we've done since the Druids' times, 2,000 years ago. And we need to change the delivery of healthcare. We're doomed to do that. This is one of the ways of doing it.
That's true, but you haven't mentioned in sort of the hand-waving process that this is basically what you're talking about is artificial intelligence. And it can be used not only for the patient to get more information about their care and where the trigger points are, but we also need to use it to help the physicians know when a new study is coming out. And that's why if you have artificial intelligence, it can look at the broader picture and at the individual record. What you're going to be able to do is, if a new trial starts at Karolinska, the person is alerted that maybe this patient would fit in there. Just like we get ads in our Facebook page when we look at something online, they learn how to incorporate it. And we haven't done any of that yet with the medical system, and we're going to have to go there.
Absolutely.
Comment there? Yeah.
I think we're starting to get there. So, as an example, that sepsis algorithm I was talking about is using big data to identify patients that are at risk of sepsis, and then is pushing the doctor towards delivering the best care, because we know what that is. And I don't think we're anywhere near automation or artificial intelligence, but I think we are certainly there with making sure that doctors have got best practice and trying to narrow down. Now, what is it, the statistic? It takes 15 years to get from research through to actually on the ground, and that's only in about 20 or 30% of the case. So I think we're starting to get there, but there's huge amounts of work to do.
Was there a question there, comment there from Jasmine?
Yes, I do. I wanted to ask about gamification, if you are thinking about employing the gamification in any of your systems.
Was it the question about gamification? Yes. of using the mechanisms of gamification into the systems to
Exactly.
help trigger patients actually work?
Either in the patients or in the healthcare professionals. For example, with the virtual hospital, you need healthcare professionals engaged in the system. And
Sure.
you need them to input the actual data and enjoy inputting the data.
Yeah.
So how do you do that without them wanting to do something else? And also you need to motivate and engage the patient in order to, you need to get their minds off of being sick.
Sure.
You
Anders, you wanted to comment on that first?
Yeah,
And then Nico?
I mean, gamification was the sort of buzzword a couple of years ago, and since we learned quite a bit on it. In this application, we have worked together with a Swedish psychology group called the Psykologifabriken, or Psychology Factory, that have given us a couple of tools on reward side and engagement side, but we are actually quite careful threading in this direction. We need to know that these applications that we put in this space are validated and tested, because you can actually cause damage by doing it also. So it's a powerful tool, and therefore it needs to be used by great care.
Mikko?
Yeah, I mean, we talked about it a lot when we were designing the service. My background is in product design and product development, and half of the products you release on the market fail. And we really carefully monitored how people behave and thought about gamification for making the service happen. But what we realized is, like, you don't do it. You just support existing behavior. You don't try to change the behavior. Behavior change is so damn difficult. Try to go to the gym. If you're not used to it, difficult. Try to eat the veggies. If you're used to eating beef, difficult. And just by supporting, what we ended up realizing as an insight was that we need to design the service to behave like you'd expect it to behave. Like, for example, our brief for our chat service, like, let's make it look like WhatsApp. So, like, because people are using WhatsApp and Messenger, let's make it look like it. So it really, on both sides. Also for the doctors, that was easy for the patients, and then for the doctors, we really had to go from desktop to mobile and bring in this service that it supports their lifestyles as well. Instead of like giving high compensations for doctors to be able to perform their job, one of the reasons why the compensations are high is that it's strenuous. But with us, when I mentioned that we've been able to cut down costs from the doctor side to perform the job, is that it's so easy. They like to do it. It's like they like treating patients, but if it's like feeding the beast and like putting all the data to the medical records, which in fact takes 30 to 35% of the time, if you can take that time down and just focus on the act of medicine, I think the need for gamification goes down a lot.
I know we're getting close to, we should have probably finished in a minute, but I have actually one question here that, I mean, we talk about the current healthcare professionals, and we're giving them tools to do new things, but we're not talking about medical training. Nobody's mentioned, what we do in the actual medical training sector to prepare the new healthcare professionals to enter this new realm of digital world. Any very short comments on that before we stop for the next break?
So I think what we're doing is we're working with the local universities, and we're actually starting to put our system into the universities so that the students of the future, both doctors and nurses, actually come out trained and ready for the new world. Because if it's so different. Yeah. It's a different, But
at least you're there, and you're trying to. Okay, perfect. That was thank you. I know, Sabine. I know you have some instructions for the coming break. I just want to say thank you, Mark, Mikko, and Anders. Thank you very much to the panel for a great discussion, and thank you very much.